All right, guys, I need everybody to listen up right now. I need you to stop assuming you need dental implants just because your teeth are in shambles. Today, we're going to get into it. Okay, this is an example of a case that so many times patient comes in and, hey, doc, I just want you to take my teeth out. I want implants. We've got obviously a lot of issues. We've got missing teeth, rotated teeth, drifted teeth, scrunched up teeth, crooked, different heights. We've got a lot of different colors going on. I get it, right? The ads over the years have talked about how great implants are, and that's what we should do. We're not going to get decay anymore and all this stuff. But when you can go from your natural teeth to a prosthetic, that's what you really need to be thinking about. Instead of thinking about you're getting these implants. Implants are prosthetics, guys, when we're talking about them in general terms. This is what I'm talking about with implants. And does this look beautiful? Absolutely. Let me put a big screen for you. So this is what I'm talking about. Beautiful prosthetic, absolutely gorgeous prosthetic. Porcelain teeth, you can get these in acrylics or porcelain. You can do all kinds of different things with them. They can customize the staining. Really cool stuff, great technology. These work absolutely incredibly for patients that are in dentures or snap-on dentures. When you upgrade from dentures or snap-on dentures to a fixated hybrid like this that is absolutely gorgeous, you will have a good quality of life enhancement. But when you have natural teeth like this and they are still solid and they can be saved, we can do something like this to them. Man, that is very, very natural feeling when you're all done. People come in and their teeth look like this. Turn this lower off. Hey, I need implants. You can do this in a single day, guys. We can do this in a few hours of time, 6-8 hours of time. You can get some beautiful temporaries that look like this, and you do not have to lose your gums and your bone structure in your face. And anytime you can keep at least some of what God gave you, that is a wonderful, wonderful thing to look at. So I just wanted you guys to realize, have an open mind when you come for your consults. Even though things are not in the best of shape, you have to have an open mind, not in the best of shape right here. You got to have an open mind and realize that, once you really discover what the solution could be, then you'll know if going to a prosthetic is better. And I'm here to tell you that anytime that we can do a setup in our consults, and we can prove, and in this patient's consult, what we proved is that to get them a really nice looking smile, we had one front tooth that was an outlier, one canine that was an outlier, and the other front tooth here that's a little bit retroclined that was an outlier. If I could shape those teeth to parallel them and get them straight looking, proportionate teeth, all of a sudden we get something that just feels like I got my teeth back. The default solution should be, hey doc, can you save my teeth in combination maybe with some implants for some of the missing ones, rather than I just want them all gone and I want one of these new prosthetics right here. Guys, they're called prosthetics for a reason. This right here is just getting your teeth back. This is what we call crown and bridge in dentistry. This is just a matter of reshaping teeth, and you get to keep your roots. So thanks for watching. I hope this opens some people's eyes to realizing that we don't always have to jump right to the solution of wiping all the teeth out. Anytime that we can work with at least some solid teeth, that should be our default mechanism as dentists. That should be your default mechanism as a patient. And you're always going to have something that feels more natural when you're done. Thanks for watching, guys.